Research shows that most people that are suffering from outer hip pain while lying on their side in bed are treating the wrong problem. So today I'm going to show you 4 things that you need to stop doing and 1 simple exercise that you should be doing to fix this pain for good. Most people treat hip bursitis as the main cause of their hip pain while lying on their side in bed, but research shows that this really only accounts for 8% of cases. Inflamed muscle tendons overlying the hip is the real culprit in most cases, and 1 great exercise can fix both the tendinitis and any bursitis you might have. What not to do? Firstly, stop stretching your glutes. If you have outer hip tendinitis, stretching can strain those tendons further. Don't cross your legs when you sit, or stand with all of your weight on one leg and your hip to one side. Both of these things irritate tendinitis too. And don't do clam exercises, because this rubs the tendons over the hip bone and can irritate the area. Instead, you need to strengthen your outer gluteal muscles and their tendons, which, as a bonus, relaxes the muscles and takes pressure off any bursitis too. But we don't want to strengthen while lying down. Strengthening in a standing position works a lot better because it mimics the natural way that your hip muscles work. So set up standing on the leg of your painful hip with your other knee bent and hands against a wall. Then begin by bringing your other knee out to the side as far as it'll go, and then use your outer gluteal muscles to slowly tilt the other side of your pelvis up to get that knee even higher. Pause for a moment at the top and then slowly lower down. Repeat those 3 distinct steps: leg out, the slow pelvic tilt up, and then the slow lowering down. Separating the movements helps to make sure that you use the right muscles at the side of your hip to tilt your pelvis. That's the key. Each time you tilt up, aim to get your knee up as high as you can comfortably. Tilting your body the other way as you tilt will help. After anywhere between 2 and 10 reps, you should begin to feel a burn or some tiredness in your outer gluteal muscles. Stop as soon as that begins. If that feels too hard for your outer gluteal muscles, do the 2nd and 3rd steps, the pelvic tilt up and down, a bit quicker, and don't lift so high. Repeat the exercise 3 times a week to light fatigue, always making sure that there's at least 1 day rest between sessions. If your hip pain is coming from the actual muscle, which it can in some people, you'll notice an improvement between a couple of days and a couple of weeks. If it comes from the tendon part of the muscle, so true tendinitis or tendinopathy as we now call it, it can take 3 to 6 weeks to feel improvements and a few months to fully resolve. Either way, keep at it. And when you feel better, don't stop. Keep your hip muscles strong to stop it from coming back. I'll leave links below to other great variations of this exercise. And it can really help to release any muscle knots in those outer gluteal muscles before doing this exercise, so definitely watch this video next.